cannot be wrong, right? If she's
How do
writing
you know?
that.
How do you know? Why do you think? Maybe there are more asanas.
What he's saying is right.
Yeah.
What we're feeling it is another story.
Whether you feel all of that. If not, should we adjust
There
to
is a
feel
lot
that?
of research, right?
Is it a she or a he?
No,
It's a he.
think it's the chair.
Okay, Trikonasana, please.
Oh, it's a guy?
It can be gone, yeah. That's the man's name.
We
Yeah.
want Suki explaining Trikonasana.
Oh my God.
Oh, that was fantastic. Please come.
Should I come to
Yes,
the front?
please. Use my mat.
Okay.
If you have eaten too much, sorry. That's fine. That's fine. Yeah, it's pretty nice mat. You will not sit on that mat.
All right. Ready, everyone? Yes. Let's take a wide stance. So let's make sure we get the feet correct. So take your right foot out, straight in front. If you're looking at a clock, your right foot, the front foot is at 12 o'clock.
Perfect.
Okay.
That was good now.
Now, angle the left foot. So it's about 30 degrees between 9 and 10 o'clock if your back foot is looking at the clock. Okay? Hands at the hips. We're going to just move the hips left, right, left, right. And the reason we do that is to just make sure that they're in the same plane. We don't want the back hip coming forward. We want both hips aligned in one line. Now, take the hips to the left and keep them to the left. Take the arms horizontal. Imagine there is a rope 2 to 3 inches in front of your right hand. Reach for that rope. And now start to pull that rope down. So bring your hand down, pull the rope, pull it down, 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 down. Place the right hand anywhere on your right leg that is comfortable for you. Put your left hand on the left hip. Now we're going to stack the left and the right hip. So pull the left hip back, pull the left shoulder back. So everything is stacked, the hips are stacked, the shoulders are stacked. Take the left arm up. If it's comfortable for you, look through the middle finger, look through your nose at your hand. Breathe, do not hold the breath. Now to get out of this, go ahead and bring the left hand down to the hip, bend the right knee, and simply come on up. Other side. Okay? Left foot out, right foot in. So align the feet, please. Hands at the hips. Move the hips left, right, left, right. So make sure that your right hip is not rotating forward. You want to keep taking it back. When the right hip goes to the right, stay there. The right hip, the back hip. Arms horizontal. Reach for that imaginary rope and pull it down. Reach, pull it down, pull it down, pull it down. Bring your left hand down. Anywhere on the left leg. Right hand comes on the right hip. Pull the right hip back, pull the right shoulder back. So that you're stacking the right hip on top of the left hip, stacking the right shoulder on top of the left shoulder. Now, go ahead and take the right arm up towards the sky. Make sure that there's not a lot of weight going into the hand. You should be able to just have your left hand off the leg. There's a lot going on here. Look through the bridge of the nose at your right hand. Breathe. And we're going to release. Bend the left knee, right hand on the hip. Come on up.
Okay. Triceps brachii.
Extension.
Do you know what's the difference between biceps and triceps?
Yes.
See that? Biceps are here, this side. Triceps are this side. So triceps are the muscles that help you. It's like, you open the cork, the the bottle through using the triceps. It's those muscles. And then feel your internal obliques. And does that all happen? Did it all happen? Did you get a stretch in the internal obliques? Gluteus medius, if I'm right. Yeah, medius. So it's just this side, because the gluteus muscles are all over the place here, right? There's gluteus maximus, there's minimus, and there's medius on the sides. And then, I won't worry too much about the tensor ones, but piriformis. Is it inside here, piriformis?
It actually goes through the buttocks, and
Yeah.
in fact, when what's it called, the nerve pinching,
Yeah.
we saw the
Sciatica.
sciatica.
This is where I thought piriformis is. So, however, this picture is a bit interesting. It doesn't give the
It's still in the back.
posterior view. Yeah, it's the back side. He should have done it. That's why I said, is he always right? The posterior picture is not given here. It's actually at the back. This seems to be here at the groin region, but it's not. It's at the back.
It's kind of shown at the back because you can see the bone in front.
Yeah. I think
Kind of
that's
blue.
correct. Probably, maybe that's what he meant.
Yeah.
Or you might have given a little bit grey.
If
grey
he had
color
given a
like this.
posterior picture, then it would have been easier to understand. Okay, then so piriformis and serodius. That is these muscles here inside muscles.
Sartorius. Basically, it's quadriceps.
Quads, right? They are quads.
It's one of the quads, four muscles.
Four muscles.
So one of them is
this. So basically, you will feel. And one thing to note is that when you are bending forward, if you pull this too much, you are going to hurt your knee, inside of the knee especially, over a long period of time, not necessarily immediately. If you feel a stretch that is not too comfortable, you want to back off a little bit. And Bihar School of Yoga says you can bend your knee a little bit. So we always go from Parshvakonasana to Trikonasana. The preparation goes like that, right? The reason is that is Parshvakonasana helps you get a nice hip opening along with this being bent initially. This also strengthens, and now when you keep it straight, you have a pull, you have a stretch. And as long as you keep that stretch to comfortable level and not beyond that. So don't insist on your students to always keep their legs straight. Sometimes a slight bend actually is safer for them to practice. And one of the websites where I was going through the Trikonasana said that don't push them too much to keep this back. Sometimes a slight forward tilt is also safer, and slowly they can work on going towards the total perfection of the asana. So all these tilts, and the body is trying to sort of adjust, right, by tilting forward, by bending the knee, and now you keep saying, oh no, keep the knee straight, and then the asana also looks, for example, you are going all the way down like that, and you are practicing, keep this back, keep your hand down. They are trying to look at your picture perfect asana, and they try to, if they start tilting, you say no, stay back. They are lost. How do I practice this? And they tend to overdo that. That's why it's okay to say, it's okay if you keep your knee slightly micro bending is fine, and slight tilting is okay. Try and start working towards that. Just don't go beyond your pain threshold. I have heard my own inner knees practicing Trikonasana in that most perfect manner from my own personal experience. And those pain won't heal anytime soon, because over a period of time your microfibers in the knee would have torn. So it will take a good deal of time to heal.
Then we do knee therapy.
Then we make money out of them. Yeah. So, all right. So you all got all these muscles, right? Okay. Next practice. So muscle groups involved is already given. We'll go into the next asana.
So Ashwini, in some of the muscles, it's very easy to realize that they are stretching as shown in the picture. But some muscles are not very evident.
Yeah.
So
Some muscles are not very evident. That's why we have taken only those which are. Trikonasana. Only those big group of muscles are shown here.
The
Okay?
one that you were telling that comes from the back, even that,
Sorry?
Piriformis.
the yeah, that also, how do you feel?
How do you feel piriformis? Question. Somebody wants to take that?
Yeah, how do you feel? So this
Like
is how
the
I
stretch.
to slightly beyond your capacity. So when you come back after doing that good stretch, when you come back, I felt it because it was slightly paining, and I don't know whether I'm pointing to the wrong thing, but it is right here.
Yeah.
It's the right place.
Deep in the back, right?
Here.
And there are other postures where specifically that muscle piriformis can be highlighted or stretched. And a couple of asanas, examples would be threading the needle, Suchirandrasana.
Okay.
And then happy baby pose, Ananda Balasana. So those two, yeah,
No.
that's
When you go here, you feel a deep stretch there.
Yes.
That's the pose. That's the muscle. That's the
What
muscle.
is that pose?
Suchirandrasana, threading the needle.
Oh, I thought threading the needle was this
Yeah,
one.
that's-
That's what I
This
thought.
one is like the figure 4.
Figure 4, yeah. Figure 4.
So that you will.
Correct, that's figure 4.
Oh, okay.
No, no,
That also feels the same way.
Threading the
no,
needle.
that's threading the needle. That's figure 4.
I think different schools label it differently.
Yeah.
I've learned that one as the threading the needle.
Okay, so just to clarify, in our manual, however, this we don't call threading the needle. We call this figure 4, and the other one you wrote is you did this. Okay, now sorry, now picture is not exactly the same as what I wanted it to be, but this is Ardha Chakrasana, and we'll now study on Ardha Chakrasana. Who wants to teach Ardha Chakrasana, please? Anybody wants to teach Ardha Chakrasana? No, I said picture is not correct, right? I didn't find the picture of Ardha Chakrasana.
That looks scary.
That's scary one, yeah. But then it has back bend, so I just picked that. We are working on those muscles, that's why. Anybody wants to teach Ardha Chakrasana, please?
Ardha Chakrasana is this also,
Yeah,
right?
yeah.
Not the one which is shown there.
No, don't worry about the picture. Yeah. Okay. You want to? Come.
Can I use the plants?
You can
Yeah.
use my Use mine.
So take your hands back of your waist, fingers pointing downwards.
Yeah.
Okay. Now, as you inhale, bring your elbows close to each other and lengthen your spine. As you exhale, arch back as much as you can. Stay in that position. Breathe normally. As you inhale, bring your torso back to the center. As you exhale, relax your hands.
Can you do the other one?
Which one? Oh, normal swimming skill. So feet together. Now, as you inhale, raise your hands all the way up. Arch back, chin to the chest, so that you don't hyperextend your neck. Tighten your glutes. You may feel slight vibration in the core. Breathe normally. As you inhale, come back to the center. Right. As you exhale, lower your arms.
Okay, some of the notes here, you may agree, you may disagree. This is all discussion. Pull your spine upward, contract your gluteal muscles, engage your core muscles, and push the pelvis forward.
Yes.
Yeah, push the pelvis.
All agree? All okay?
Yeah.
A slight vibration in the core muscles. What is happening to the core muscles here? What parts of the muscles are engaged and yeah, obliques. These are ab stabilizers, right? And so we think that backward bend is only for the spine. It's actually for the core as well to hold you in place. Yeah.
Achia.
So if you focus in your class on the on that aspect, then they won't hurt during their back bends. We used to see this routinely during Surya Namaskar Yajna. People going practicing this and coming back after 7 days, 10 days of this practice and saying, I've hurt my lower back, because they just go like that. And the whole pressure is on the lower back because they are not using their core muscles to lengthen the spine. And so we found this so repeatedly and so frequently, like so many of them coming and saying, you know, after 10 days of this practice, then when we started teaching the extension of the spine and keeping the head neutral, because they would go, see, as soon as you take the head back, all the pressure is on the lower back. Please try that. How even children practice this. They just simply, first thing they take is head back. All of the pressure is on the lower back. You see that?
Yeah.
That's how they used to practice regularly. And since then we have been just insisting on training and practicing, giving this instruction. That has changed.
Then we need to put the chin down.
Chin down. Yeah. In fact, she did a good job of saying keep the chin down. Not necessary, but what has happened is by saying that they will at least do some of it. Otherwise, happily they just stretch the neck, thinking that stretching the neck will take them to
Further back.
further back. Yeah.
So
That's what.
Ashwini, the other thing that I really like to do, it helps me anyway, is squeeze the glutes.
Yeah. We say contract the
Yeah.
gluteal muscles.
Yeah.
Yeah. That will,
It's a
and
more
that will
stable.
support the lower back.
Yeah.
Yeah.
Can I add a couple
Yes,
of things?
please.
So, one of the things that you rightly pointed out is so one of the things that Ashwini ji rightly pointed out is it is also good for the core. So, what happens is usually when we engage the muscle, we think of contracting the muscle. That's when it's engaged. But there's also traction. In other words, the rectus abdominis, one of the abdominal muscles, when you arch back, it's actually lengthening. But it's lengthening as well as it's trying to put that force so that you don't fall all the way back. So it's not contracting, in fact it's lengthening, and yet it's offering that resisting force so that you don't go all the way back. So that's called a traction back bend, and in fact we covered that in the core slides. So I just want to refresh everyone's mind on that. And a couple of things that I've seen a lot of beginners do, and I think I also pointed that before, is when we do the Ardha Chakrasana, tendency is, just like you said, arching or tilting the head back, they think they're going further back. Two more things they do is bending the elbows, thinking that they're going more back, and bending the knees. So resisting the temptation to do that. So we can give a explicit instruction saying keep the arms straight at the elbows, keep the legs straight at the knees, and also resist the temptation to push the hips back. In other words, sometimes people do this.
Yeah.
So the hips should move forwards because the arms are moving back. Something should move forward so that the center of gravity is aligned with the vertical axis.
So just one thing I'd like to add, my experience has been, yes, you have to keep your legs straight, but don't lock the knee. Normally, I see that locking the knee will be not good. Generally, I keep it micro bend, not necessarily lock it, so that way it becomes easier on the back and onto the back. I don't know, that's my experience.
Yes, that's a good suggestion. And also talking about the legs, it's a good idea, especially in Surya Namaskar, because you have a quick succession of arching of the back and bending forwards. It's a good idea to tighten the muscles of the legs. And again, we have seen this before, because especially when coming out towards the end of the sun salutation, we're in the forward bend and suddenly we come up and then arch back. So sometimes if the circulation is sluggish, then all the blood will rush to the lower extremities. So there is not enough circulation in the head region. So you might feel dizzy or lightheaded. So when we contract the muscles of the legs, then it prevents that muscle pump effect that we saw.
Yeah.
So there is still sufficient supply for the head region.
How do we keep the knees natural position? Because when I'm doing that, I feel like I'm automatically tightening my knees.
I feel that when I tighten the glutes, then the thighs are anyway tight and the whole muscle pump he's talking about is happening anyway. When you, as soon as you tighten your glutes, the whole of legs you just tighten and pull it up. Then that's the effect.
Yeah,
Go ahead and try.
When I'm
Yeah.
working the glute, then
Yeah,
automatically
tighten the
muscles are
glutes,
tight.
the entire feet are pulled up nicely, and then you are nice and firm after that. That's why we say tighten the glutes. One other thing about raising the arms up fully like that, it can cause some amount of pinching of the shoulders. So you are very flexible, Sriram. So it just becomes easy for you. But many people do this and they feel that this is too tight because of their problems. Otherwise, I understand that it's a good stretch from the sides and everything. I like it, but I see that people tend to pinch them too much. They are, as it is, very tight in this area. So we say relax your shoulders. So not bend elbows too much but just relax, not too much holding up here. Just because many carry problems here in the shoulder region.
Is it better to keep the arms open or?
Arms open is also okay, but then I like to keep them together because it helps me drag further back.
Actually,
But
when
you can
climb,
always-
Then you can tend to keep your arms straight.
Then there is a possibility, yeah.
Yeah.
Then you can keep
Otherwise,
them.
they tend to bend, but if you hold, they support each other.
Right.
And then you can straight, but not really stretching, but just keeping straight.
Stretching too much, they might pinch here, and that's the concern we have. Otherwise, even stretching them up here is not a problem, but many of them have upper back and shoulder issues, especially working like that. That's one.
Also in the Krishnamacharya tradition, one of the hand position is to interlace the fingers and open the palms up.
Yeah.
So they prefer that.
Yeah,
doing.
that is also good. In fact, we have brought Surya Namaskars. We do alternate ones, and one of them has this one instead of the usual one, so that they get the alternate modified practice as well. Okay, and then people with herniated discs, they have to exercise caution, and also hernia and herniated disc both. Okay, that is the now muscles. Sorry, I don't have a better picture. Don't worry about the picture. I have taken all these pictures just to show the muscles. Okay, leave the bottom portion there. Just look at the front muscles, especially pectoralis major, external oblique, rectus abdominis, and triceps brachii. Here the elbows are taken back, but don't worry. Just keep the elbows, even if you, elbows are bent, but even if you keep the arms up extended, you will still feel the stretch in the triceps. So that part is what I'm more interested in. I did not get the picture of Ardha Chakrasana, that's why. And also the other two, where he's showing some of the backside, serratus anterior, spinal extensors, those pictures too. Serratus anterior especially. Please feel that. Pectoralis major, when you go back, right? And the first one that Nikita showed, right? Where bring the elbows close to each other. This is the area that gets stretched, pectoralis major. And external obliques, please point to your muscles, external obliques,
No, it's outermost.
to the side. Rectus abdominis is in the center. Six pack, yeah. Rectus abdominis is the six pack muscle. Okay, then triceps, because you are stretching up here, triceps. What else? Serratus anterior. What is serratus anterior?
Serratus is the saw muscles on the sides and the.
Oh, these ones?
Yeah.
Oh, this one.
These
The
muscles,
shoulder
yeah.
blades?
Yeah. Okay. Right here.
Oh, anterior.
Anterior.
Ashwini, is it okay to keep your legs hip width apart when you are
I'm not sure
or
how.
not?
I don't know. I don't feel that is right, but
No, I feel that it's good. to
Okay.
have- Yeah. I think listen to your body.
listen to you.
Because
I
that's
like
Great.
what I feel some students, when you tell them
Yeah.
you keep hip width apart, they are in much better shape and
Yeah. I think it's easier to lose balance with the feet together.
In
So
the back
beginning
bend.
students, I think it's a good idea to separate the feet. And the advantage of keeping the feet together and especially with the toes together, it gives the internal rotation. It protects the lower back.
Yeah, that's why I felt I didn't like bending back with feet apart because I know I have some lower back
Yeah,
issues.
but some people who have thick thighs, keeping them together might be a little bit hard.
Yeah.
So keeping just gentle, little bit, just few inches, can have much better stability and comfort in the lower back.
Okay,
Well,
listen to your body.
Also, I think if you look at it historically, yoga was always taught from men to men. And so men's hips are, and thighs are different than women's. And, you know, so I think for women, sometimes you need that little extra space.
Women who have had children.
Possible
That
because
this
the
is different,
pelvis,
right?
pelvic bones are different.
Yeah.
Okay, now going to deltoids. Right, same thing. I've picked different pictures here. I'm sorry I didn't get the Ardha Chakrasana. Can you identify deltoids?
What did you say?
Deltoids,
Here.
What is deltoid?
Upper arm.
muscles, deltoid muscles.
The side of the leg.
Upper arm.
Deltoids are these, not the upper arm. It looks like these are shoulders. Shoulder muscles are deltoid.
Shows hand.
Upper arm, right?
No,
Yeah.
upper arm. No, it says here.
And you get to see pectoralis major even better now.
And
you see
serratus.
rectus abdominis also much better.
And serratus also. Serratus
And you
anterior.
get to see serratus in anterior also much better.
So serratus anterior is the muscles between the ribs.
Yeah,
Shoulder
so
sides.
if this is pectoralis major, then your serratus anterior is by the side.
So are we still discussing Ardha Chakrasana?
Yes,
but
yes.
just using
All the
pictures?
three muscles that we talked about, yes. Just looking at those muscles, okay? And psoas, see psoas minor here, very nicely. Psoas muscles by the side. When you stretch up, actually you are stretching those all as well. And you see psoas major also. That's why I picked up all these different pictures, which are not necessarily Ardha Chakrasana, but you see that similar muscles are being stretched.
What is the difference between psoas minor and major? They seem to be the same muscle.
Upper and
The major one is a big muscle. The one minor is a small one, probably behind it. Yeah. All right. So, what are the therapeutic benefits of this Ardha Chakrasana? Flexibility and strength in the back. Then opens the
Strengthens the
rib cage
core
for
muscles.
better breathing. Great for asthma.
Asthma.
Okay. All the back bends and the
Opening of lungs.
opening of the chest, yeah, are good for abdomen, and also good for people with depression, with low self-esteem. All the back bends are considered good for them to feel confident, improve the confidence.
Is this related to like you are getting more prana and you are opening up yourself?
These are some of the visualization also need to be brought up when you are giving these techniques to them with a therapeutic need, right? Then you can say when they are bending back, feel that confident self within you is good enough to now improve the effect of the posture 100-fold. Right? And stretches the abdominal organs, including pancreas, good for diabetes, stomach disorders, and also helps the intervertebral disc by promoting imbibition. Now we should discuss this. What is imbibition? I think Sriram had brought this.
When we looked at the spine, so imbibition, when you look at the living cells and tissues of the intervertebral disc, there is no direct blood supply to it. So as babies, there is still blood vessels that is carrying nutrition to the intervertebral disc, but as we grow up, these blood vessels are no longer active. So the only way in which the cells of the intervertebral discs get nutrition is by this process of imbibition. Imbibition is something like osmosis, like a sponge. When you contract and expand, when you squeeze, that's when there is transfer of fluids, and that's the only way in which those cells receive nutrition. So a sequence of contraction and lengthening the spine and backward arch and then bending forward. So combination of all these practices will help this process of imbibition.
There's a fluid, you said, I think, around these muscles and
Nucleus pulposus.
yeah.
So that's the only way it breathes the nutrition.
So in simple terms, what we tell our students, so it is like it's good, the spine will get
Nourishment.
nourished as a result of the compression and expansion of the spine.
Yeah.
Okay, I think you have to read up on the rest of the things. Now we'll go into Padahastasana because we just did this. Padahastasana. Okay. Anybody wants to teach Padahastasana, please? Okay. We have some comments here.
First add up Ardha Chakrasana and exhale from your hip joints and slowly bend forward. And feel the stretch in the hamstrings. Inhale, slowly come up. Relax.
In the manual, if you go through, we have two-part practice. One is as you inhale, raise the arms up, stretch up all the way, and then as you exhale, push the hips backward, keeping the thighs contracted. Push forward, engage the core, and stay here. And now take your hands just anywhere, just above the knee or on the shin here, and lengthen the spine and slowly collapse down. So forward fold. That way you can make sure to keep the lower back, the curvature of the lower back, which is the lumbar curvature, intact through this. This is the most important, but however, some 70 to 80% of the people in the class will be like that. Nothing much you can do about it, but we can now discuss what we can do about it. I mean, not necessarily do something about their lumbar curvature or their Padahastasana practice, but how do we safely practice? And there is also a debate between giving them the practice with knee straight and letting their lower back get that pressure, or bending the knee and not giving them any stretch in the hamstrings. So which is the best way? That debate is on. The jury is out there, but we can discuss what else can be done through this session here. Before we go there, let's talk about some of the subtle points. And I don't know what I meant by keep the hips aligned. His comment is valid there. I think there are in some cases people don't work on keeping their, this is what I meant actually. So instead of doing this, if they kept their hips like that, wherein they bent their knees and not really focused on keeping the legs straight, then the hips and the legs will not really be useful in getting the real effect of Padahastasana. We can remove that, keeping the hips aligned. But starting from the aligned Tadasana, and then engaging the quads and the core muscles, very important there. And then
Should they contract their
two-step process. Yes.
core? Should they contract their core and then pull forward? Pull it in?
Engage the core, yes,
Pull it
like
in.
pull it in,
Yeah.
and the quads are engaged,
Yeah.
and then they can forward fold, making an inverted L shape by bringing your torso parallel to the ground, and or place your hands on the hips. Lengthen the spine and forward fold. This is a good way to teach the Padahastasana practice as a asana. In Surya Namaskar it's different, and yet even in Surya Namaskars we can still ask them to keep that spine long and with its curvatures, erect.
I think as you go down, it would be good if people can give the instruction as to first slide your stomach on the thighs, and if that's all you can do, stay there, because you don't want to curve your back and try to touch your head when your chest has not yet come there. So the goal is not to just, I mean, in my view, I might be wrong.
How
So-
do you want them? I am like
so
this.
I
right?
like you touch your stomach to your thighs, if that's all you can do, and keep the curvature.
How? How?
I can-
My stomach won't touch this. I am going to be like
Maybe
that.
with knees
If the
bent.
goal is to touch your head to the knees, then you will get that curve.
Head to the knee. I'm here.
Okay, bend your
You're,
knees.
you're talking about patients who are here.
I'm talking about
Most of the
people,
people.
not patients. I'm sorry, not
Can you
not
bend your
patients.
knees?
I'm just a person, healthy person,
Normally,
who is
Normally,
not
you
flexible.
that flexible.
need to use a wall.
No, that's fine. I'm doing Surya Namaskar now. You want me to go to the wall?
Yeah, Surya Namaskar. It's
Huh, so how do I practice forward bend?
Then
Maybe
you have to
bend
bend
your
your
knees.
knees, because in Surya
How
Namaskar
many,
you have
if
to
I go on bending the knees, then I'm not going to lengthen my, stretch my hamstrings here, right?
But Surya Namaskar is different, because you need to get to the ground. To
Tell
do
me,
the
okay, can I have you come here? Vikram?
Oh boy.
No, I think that difference in the experience, whether it's Surya Namaskar forward bend or Asana forward bend, right? When you're doing Asana forward bend, the focus is different. Surya Namaskar is very short and that we
You
can
need to get to the other part.
again explain this what you're planning.
I can't.
No, that's fine. That's why we called him. Now, what do you, he's not a patient, okay? He's just a fine guy. Now, what do you want him to do?
Yeah, I just don't want him to bend his head at this point and touch his knee. If that is what your capacity is, you need to hold it here and maintain that curve and make sure that with
No,
so
what,
now exhale.
you want his head to be up here?
Yeah, head.
Why?
Because I don't see any point in him touching the knee when you're going to kind of.
No, why can't you drop the head down? In fact, I was
Just
going
like
to say
loosely
that
drop
this
that.
is where.
No, two up to your capacity.
Yeah, loosely drop
Can
your
you kind of catch hold of your legs and then try to touch your. Is it possible? No, that's all his capacity is.
Okay.
So there is no point in.
But you
trying-
can see that there is
So
a.
there is like a.
He has curled his back. Is that
so,
okay?
No, the simpler version of Padahastasana would be this one, right?
You are not the good example.
No, so this is for the easier person, like even with a slight back pain and you don't want to give the other one.
So you are helping him now. Please help
So
him.
catch
Help
hold
him
of your
now.
toe if you can.
No, he cannot.
Okay, maybe you get up now. Okay. Stretch up. Stretch up. And then slowly stretch your arm forward like you're reaching for something, and bend from the root of your back. And very, very slowly, mindful that you're not moving your spine in any way. Okay, now reach down, down, down. Abdomen touches the thigh. At this point, just stop
Abdomen
moving your
doesn't
back.
touch the thigh.
It's not.
So what happens? What happens like
You're pushing the hips back, right?
Yeah.
Yeah.
So
That's a fantastic.
So you're expecting that you'll be able to do CMA, right? But the moment you come here, it gets stuck, and then you tend to curl your back.
Then how about
Because-
using the wall between?
Well, what is the, if there's no flexibility, I'm a good example.
Yeah,
I can't even
that's
move
why I
forward.
brought Vikram, right?
Yeah.
Vikram is a good example.
Yeah.
That's why sometimes it's nice to have people who are not flexible be the teachers, because they understand what are the problems, right? With the, if Sriram is a teacher everywhere, I'm intimidated,
How
right?
about he breathe? He has to breathe in each time and he will lower it. That's what I wish.
Okay,
Every
I
side.
think the point is there is no flexibility here. You cannot go beyond certain angle here.
Yeah.
So then you start curling your back.
Take a step
Yeah,
forward.
Right.
but what I do is, I cannot go right away like that. So what
Yeah.
I do when I'm here, and from my root of my back, so I can feel here the root.
Now lengthen your
You know,
spine
now
and push your hips
I
One,
back.
one
tuck my.
discussion at a time.
Push your hips back. Push your hips back. And then maybe he does this for one day and the next day his hands slides
Great point.
down.
Great point.
And things
Okay.
like that.
All right. So we'll discuss now. Now we got all the points, right? All the data points are here. What we are trying to say here is that we cannot aim for them to do the maximum. As long as that's a young lad there, totally fine. Let him keep bending, and eventually he will reach the ground. That is perfectly fine. Let's say there is a person who has walked in with a back pain like him, not his age, but maybe 30, 40, whatever, and now you want him to become flexible here, and you want to do like slight back pain. I'm not even talking about much. Then you don't want to give him too much of that. So you have to go with your student, how and what condition they are. Maybe younger people, it's okay. If they are not flexible, let them keep bending it. There's no other way they can become flexible. There are other asanas which we can, like straight leg raising and using the belt and all that stuff, which will also prepare, like the way you brought using the wall. That all is fine, but we are talking Surya Namaskars here, where Padahastasana, Ardha Chakrasana, constantly done. We just want to bring what are the best ways to do it, and yet it's okay to push your envelope just a bit here and there, and give them some tips to also become flexible in other areas through other asanas, and eventually they'll be fine.
I just want to make
Yes, please.
3 points. So I think if there is any back pain, especially lower back pain, even little bit of lower back pain, it's always a good idea to bend the knees, because when the knees are not bent, the tight hamstring might further pull the lower back muscles. And if you remember from the spine discussion, the posterior longitudinal ligament is not as firm as the anterior longitudinal ligament, so it could cause the nucleus pulposus to further come out. So it could cause basically a herniated disc. So that is one thing. Second, so just like for backward bend, we mentioned that push the pelvis forward. So here pushing the pelvis backwards as you bend forwards in the Padahastasana. So my teacher used to say, when you are at the 90-degree angle, your body will resemble the numeral 7. So that legs will be at an angle. It won't be exactly perpendicular to the ground. The body will be the form of numeral 7. That's the second thing. Third thing, there is a reason why when we bend forwards, it's good to tighten the quads. I think that's one of the instructions that's given here. Yeah. And there's a very good reason why it is suggested to do that. And we actually covered it in the presentation. Anybody remembers why it is a good idea?
When you come up, the blood flow, the oxygenated blood, that needs to go up so that you don't feel dizzy.
No, that's another reason.
When you tighten
Is it to
this
protect the
core,
hamstrings?
No.
the core even tightens.
They protect the lower back.
So it's
Front portion when it's tied,
Tight
the
and,
back portion releases
Exactly. And the name for that is called reciprocal inhibition.
Yeah.
So people have a chronic tightness of the hamstrings, right? Inadvertently they keep the muscles always tight. So draining large amounts of prana, large amounts of energy just to keep the muscles tight, even though it's not necessary. They could actually relax and conserve that energy. But the hamstrings are kept tight. So one way to relax the muscles is to tighten the antagonist muscle, in other words the quads. So when you tighten that, as a natural reflex, the hamstrings will automatically relax. So you're able to go down a little further. So this is in one of the slides on forward bend, you will see reciprocal inhibition is what it's called. And just like Leslie Kamenov's book, there's another set of books by author whose name is Ray Long. So he goes in depth into this process of reciprocal inhibition, and he gives several examples. Like just like quads and hamstrings, there are many pairs of muscles we can use. Like if you tighten one set of muscles, the other set will automatically relax, even if it's chronically tight. It will automatically relax by reflex. So this is the process that we use.
Perfect.
Keeping Vikram as an example, if that's his flexibility right now, and keeping the goal as at least to touch his. So first of all, what would you say is the tightness? Is it in his back or is it at the back of the hamstrings?
Could be the hamstring or
And
the hamstring.
like keeping the goal as touching the ground at least one day. What other practices can we do so that?
It's just by regular practice. And one thing, if you look at some of the classic forward bends, even if you look at the seated forward bends, for example, Janu Shirsasana and Paschimottanasana, right? When you look at both of them, in Paschimottanasana, for example, the aim is to bring the torso flat on the leg. If you go to Bikram Yoga, they say it should be like a Japanese ham sandwich. So there should be no gap between the torso and the legs, like this. No gap. You could not put arms like totally glued to it. Now, in Janu Shirsasana, it's not like that. In Janu Shirsasana, the intent is to bring the forehead or any part of the head on the knee. You can do that, like if you put flat on the leg, the torso flat on the leg, your head will go farther than the knee, right? So it's not Janu Shirsasana.
Right.
So for the forehead to touch the knee, you need to curve the spine.
Yes.
So there will be a gap like this.
Yeah.
And that is how it's supposed to be done. In other words, there are some forward bending postures where that arch is actually recommended. And there are some others like Paschimottanasana and also Padahastasana where you need to keep the back straight so that the torso lies flat on the legs, on the thighs.
At some point in life.
Yeah, at some point.
This or next or some other life. Yeah.
That's the goal.
Okay. So with that knowledge, and we'll go through these, and then we'll practice the Ardha Chakrasana and Padahastasana, knowing all these things. So basically, what I meant to say, for somebody like Vikram, right? Regular practice. Let it be here. As long as he's not there for a long time and just getting that too much of a stretch here or a pressure here, where the nucleus pulposus starts oozing out. As long as he's just simply stretching as a loosening practice. So that's why in Surya Namaskar it's not an asana holding, right? So when you keep doing that, then slowly the loosening happens, and eventually, so he won't be, he'll be like that, it's okay, but he won't be there for a very short time. And then immediately you are going to bend the knee and you are going to take the leg back. So it's not so bad. But if you stayed there and you held there for a long time, then those side effects that Sriram is talking about. So then in that case, the safest way to practice is to bend the knees, so that then what I actually say is this. Please come on up. We had this in one of the sports, yoga for sports kind of workshop at Shivananda, where the teacher was saying the abdomen should come on the thigh, bend forward with the abdomen on the thigh. Okay, bend the knee, no problem. Bend the knees until the abdomen touches the spine, abdomen touches the thigh. Okay, and fully head down. And now, without moving the abdomen away from the thigh, start straightening the knee. Straighten the knee, straighten the knee, straighten the knee as far as you can straighten, and stay there. Gently come back up. So that is another practice for you to start working on your pose. Every day, just by about few inches, you will start straightening more.
Actually, I would like to add one more
Yes,
thing. Normally, what that helps to bring the flexibility is what I do is bend your knee and put your fingers below toes and start pushing your knee back. Right? I can see the lot of stretch in this leg, because now what happening is you're pushing your knee back, but there's no upper to move the back. And now I can see my hamstring, my calf, everything is getting stretched. And
as
eventually,
long
hopefully,
as
I'll
you
be able
don't
to.
overdo that.
Right? Not overdo, but
Yeah.
what I'm saying is.
That's one hell of a dangerous pose if you overdo it, because there are people who came to us for back pain therapy because Bikram Yoga does that, right? Where they said do this, and the guy just went, did that for a long time,
A couple of days, right? It's a slow process.
and that's exactly what happened. The nucleus pulposus thing, the disc herniation, and he said, how did that happen? Oh, Bikram Yoga. And
And
we
one
are
more
now
thing.
used to it. Bikram Yoga and disc herniation.
So most people think that only when the head is very close to the legs is when you get the maximum stretch in the hamstring, but it's actually not so. In fact, when you go all the way down, say for somebody who's reasonably flexible, say if they are able to go down like this. Now, if they are able to look up a little bit
Yes.
and increase, in other words, there is a secondary curvature.
Lengthening this.
Then this posture actually brings more stretch here than when you do this.
Correct. Yeah.
So this is actually more beneficial, although the head is farther away from the legs.
So that's why we say two-part stretch, right? So this lengthening here, this is also fine.
It is safer.
Everybody won't be able to go to the ground, so this is fine. And then you forward fold.
I think it lengthens the space also, right? Because the vertebrae kind of lengthens the spine, right?
Yes, and there's a technical, in fact, if you want to read up on this, it's a very fascinating thing. There's one of the earliest book on anatomy of Hatha Yoga. In fact, the name of the book is Anatomy of Hatha Yoga by David Coulter. There's one whole chapter on this process, how the sacrum and the iliacus, and the ilium, how they articulate with each other, and there's a process which is called nutation. That is the key for all these forward bending postures. So when you actually come up a little bit, you are triggering that nutation process, and people who can do very good forward bends, they trigger this one.
In fact, like my yoga master, at that time I did not understand what he was doing, but before doing the full Pada Hastasana, he would always do this. He would make us do that and then look up, and we would stay there for some time and then go into the other one. And then of course
They
we
do
had
it in Ashtanga Yoga, for example. Pattabhi Ashtanga. They actually look up and then go.
Uttanasana.
Yes.
Yeah. That's why we have that. Stay here and look up, and then two-step process. And otherwise also. CSE does the same thing.
Sriramji, does that nutation process work only in this area, or is it in other areas of the body as well?
Good question. I don't know. I'll look it up.
Okay.
I have not seen it referred to any other joint except for the sacrum and the ilium, but I'll look it up.
Thank you.
How to spell it?
Nutation, N-U-T-A.
Not mutation.
Nutation.
I read something.
Yes.
And coming back from Pada Hastasana, because you have, especially when we stay in Pada Hastasana in cyclic meditation, you stay there for a long time, right? We chant Brahmari, everything. Then Dr. Nagaratna has given us a technique where she says, don't just come up just like that. Some people try to come up like that, do all those things. Just walk your feet with full support through the legs. Just come back safely, because you have been there for a while and not everybody is flexible enough. They haven't done nutations and stuff like that. So just walk them up slowly, supported, coming back from Pada Hastasana. And bend from the hip joint. Tell them avoid hunching the back, as this brings pressure on the lower back and may cause low back pain. To get a deeper forward fold, contract the abdomen muscles. In other words, pull the stomach in as in Uddiyana Bandha, and allow the torso to get closer to the legs. Same thing that we all discussed. Now let's talk about the anatomy aspect of it. And recognize your muscles, please. Here. Gluteus medius, gluteus maximus, quadratus lumborum. Please find out where your quadratus lumborum is. And erector spinae. Is the quadratus lumborum at the back?
Back.
Yeah. This kind of shows.
And erector spine is actually a set of 3 muscles, and you can actually see
Yeah.
the 3 listed there.
Is it blurry or we can?
I don't know what it is. It is blurry.
Oh, I can fix it, I think.
By
Just
the
blurry.
end of this course, we are supposed to be remembering all these muscles.
Yeah, that's why we are going over them.
We're supposed
Not
to-
everything. Not everything. Quadratus lumborum, erector spinae, all the muscles of the, you can just say erector spinae, the spinal muscles that keep you erect. Erector spinae. You don't need to know every detail of
Next
it.
to the vertebrae.
Yeah.
muscles next
Yeah.
to the-
Goes along, that strip goes along the vertebra. And rectus femoris. Do you see rectus femoris? I thought that is, yeah. It goes all the way from, in the front or back?
Front. I think it's one of the 4 quads.
The quads, part of the quad. So we saw one of the quad muscles last time. What was that?
It starts with an.
Good.
It starts with an.
Serratus muscles.
No, that's.
Serratus or something else.
I can look up what are the
Yeah,
4.
we can. That's fine. That's fine. So we'll look at quad muscles next time. Rectus femoris, biceps we already know. Then the one thing that you need to know now is vastus lateralis. That is the leg muscles. You see the muscles there on the sides? Yeah.
Then the biceps in the legs also?
No. That's hand.
Where is the hand?
No, the femoris, it says.
Oh, this is biceps femoris.
Yeah.
Yeah.
Okay,
That's biceps femoris. And gastrocnemius. There is a C there. Gastrocnemius is another big muscle of the calf, basically. Calf muscles are stretching here. All the leg muscles are stretching. Vastus lateralis, biceps femoris, and rectus femoris. All the femur is the bone, and
Muscles
it's the
attaching
muscles
to
of the
the-
femur that are being stretched.
Which are in front.
Yeah.
most of them.
Okay. And then gluteus muscles are also stretched. Alright, we are done with that. Now let's practice with this idea. Digestive disorders. Padahastasana works very well for people with digestive disorders. That is why it's important for us to ask them to bring the abdomen close to the thigh. There's a squeezing of the abdomen, like you said. And it's okay for a person with gastrointestinal disorders, it's good to focus on the compression, and it's okay for them to bend the knee, and so both for gastrointestinal disorders and for people with back pain, make sure the knees are bent and they get the compression at the abdomen. If you tell them, oh, bend your knees, it's just a modification for you, it's a safety practice, they will not like it. Why? Because all their peers are keeping their legs straight and they are practicing so well. I am here having to modify my practice and I'm such a loser. Should not be the experience, right? So if you tell them the advantage, saying, hey, by the way, your abdomen is compressed here, your abdomen is stretched here, and that's helping your gastrointestinal problems, or that's helping your, and when they bend the knees and go down, it gives a beautiful traction to the spine and this very nice neutral support to the spine. They will like it. That's when they will like it. So you have to turn it positive as opposed to saying, oh, sorry, you are such a loser, keep your knees bent. It's not a good feeling there, right? Okay, and
So just a quick
yes.
thing. So the quadriceps, the 4 muscles, I'll just read the names.
Yes, please.
So the first is rectus femoris.
Yes.
We saw that one.
Rectus femoris.
And then vastus lateralis,
We saw that also.
vastus intermedius,
Okay.
and vastus medialis.
Okay. So the previous muscle that we talked about was not one of them.
Okay.
Last time. We'll go through that. Here, Ardha Chakrasana. We discussed.
Yeah, we see all the vast in the previous.
Yeah.
Yeah, I think all the 4 quads we are able to see.
Yeah.
Rectus femoris and all the 3 vastus muscles.
Vastus muscles. Okay. All right. So let's now practice just Ardha Chakrasana and Padhastasana with all these variations, please. Ardha Chakrasana. Keep the hands behind the back. Behind the pelvis is what we like to say. Feet together or slightly apart. Ideally together if you can. Contract the glutes and the quads and push the pelvis forward, elbows together, lengthen the spine and bend back. Slightly tilt the head and try not to take it all the way back. And actively, while you are in the pose, actively keep lengthening the spine, actively keep the glutes tight, actively keep the thighs engaged, the quads tight. And gently come back to the center. And let's repeat this with the arms above the head. Take the arms up, stretch up, up, up. Or if you would like to keep them with the fingers interlocked, practice that way. And now contract the glutes, lengthen the spine, push the pelvis forward, keep lengthening the spine, that is taking the arms up, reaching up through the arms. Keep the quads engaged, keep the glutes engaged, and gently come back to the center. And now from here, let's go bend down. Go down in such a way that the abdomen is going to come to the thigh. Okay, so first half, number 7, letter 7. So push the hips back, come to half forward bend, and then bring your hands on any part of your legs, maybe shin. Hold your shins, lengthen the spine. Keep the spine erect, lengthen the spine, look up, and slowly try and forward fold. If you need to, bend your knees and bring your head down. And abdomen touches the thigh, presses the thigh, so to say. And now if you want to straighten your knees, straighten them until the point where you get a good stretch in the legs. Head down. If you need to or can, take the hands below the feet to get additional stretch. Feel free to do that. Head goes to the knees. And gently, when you are ready, start walking your hands along the legs with back supported, keeping the chin up, come up and release.
Walking the hands up is really good.
Okay, that's the feedback I was looking for. Just gave all these different little tips here.
Coming up,
Anything?
your back is already a little straight and you carry your whole weight up.
Yeah. Yeah.
It's difficult.
So walking the hands along the legs. Especially if you do as a asana. In Surya Namaskars, it's a quick go up and bend down, it's okay. But if you stay there and get a deep stretch to the spine, then you want to be careful and not jerk it up and hurt. So, okay, good. All right, so let's now move into, we talked about some advanced poses where we had to work on how to practice them safely. One of them is Pincha Mayurasana, Ardha Pincha Mayurasana, the dolphin, and also wall supported Ardha Pincha Mayurasana. Since we have Sriram here, he will help us also. That's the preparation for inversions. That's why we had them as in one of the sets here, and I don't know how it was taught and how you guys practiced, but anybody wants to teach that today? The dolphin, Ardha Pincha Mayurasana. Yeah, since you taught already. Her pose is also picture perfect, so it's fine.
So
Okay, so we come, this is Vajrasana. You come to Vajrasana and then keep your spine up straight. And then bring clasp your hands together. Place that down. Make sure your elbows are below your shoulders. And from here, gently lift your knees up and slowly back. Bring your chin in a little bit. Continue to breathe. And slowly bend your knees in. Slowly come down. And then if you want, you can bring it into balancing. Slowly come.
I don't think half of you practiced it right, so can we walk around now? And I think I can hold it if you can help people around with this pose because they're not doing it right. At the pinch
Oh, okay, yeah, thank you.
Can we have Sriram also demonstrate that? And
Yeah.
or she will, she can do it and you can help us.
So the head rests on the floor or
Chin is tucked in a little bit, right?
the crown rests on the floor?
Not really, why?
So you want to bring, this is your gate, and then
Just touching.
should it be touching or should it be bent in?
I mean, the version I learned was a little different. It's not, head is not touching the ground.
Head is not.
Right.
Yeah, can you please?
No, because in the picture, if you look at the picture from the book, right, it was stuck in.
Okay, just
So the way I learned dolphin was just to do it like a push-up to strengthen the same muscles that you use for headstand. So this is the dolphin that I learned. Now for Pincha Mayurasana, so from what I saw, basically the way I learned it was to actually keep the head high like this and then work the feet. But there are other variations. The full Pincha Mayurasana actually lift the legs up.
Yeah,
Like
we
a
are
scorpion.
we are discussing the one that Eka teaches, which is wall supported or otherwise. It's the same that Sri Lakshmi.
Yes,
she
so
taught.
you actually look up, the head, the top of that is not close to the ground.
Okay, so we are confused now. I'm just going to show the demo that at least what Eka taught us, right? So thing is, Pincha Mayurasana on the wall also goes the same way. Basically, as a preparation, what she taught us was this. So with this and with this. So the idea is to basically go down like that as far back as possible, so that we develop the muscles here. Is that the one?
I'll check
Or,
with that.
yeah, I think we need that properly. We need to learn that, or maybe this. Yeah, I think you're right. Maybe just keeping the head a little up, but taking the shoulders back. Correct. Taking the shoulders back and keeping the head up probably is the right way. But we want to know the exact instructions there so that we are practicing it right. The idea, however, is pretty straightforward. We are learning to do the inversion. As you can see that we are pretty much in that same pose. We just want to make sure that the muscles here are developed to be able to go up inward without hurting ourselves eventually. But the Ardha Pincha Mayurasana on the wall also, which is part written in the manual there, is as Eka taught. We are going to teach as Eka taught us, and we can always bring her again. But she said take a distance here like this, the Dandasana distance, and then lie down here. Lie down.
Other way.
Head towards the wall.
Put
Yeah.
your feet towards the wall.
Here, feet towards the wall.
Oh, and then walking.
Which way is that? Are we doing the right? Am I doing the right?
This
Yeah.
is the
Yeah.
handstand.
So like that, right? Yeah. Yeah.
Yeah, L shape.
Yeah, your hips. So L shape. Yeah, this
Oh,
one.
L shape,
Yeah.
This is what.
She taught us this. This is the same as the one here,
Yeah.
where we use just here. Same as that. You should, feeling should be the same.
Yeah.
Head should be up or down, I don't know, but
Manually it's down.
in the manual it's down. Okay. I
And
don't
then
know.
wall
We'll see.
supported down.
Okay, can we practice the wall supported one for those who can? And then we'll have Eka come and teach us right way. At least if we have tried, we are better off. We can start this. Please practice those who want to. If you don't want to practice, that's fine. We'll wait. Practice when Eka is around.
I can bring
No,
my
no, no.
hands.
You have to have exact distance
Like
of
my
your
hands.
legs.
Yeah.
So, little bit back like this.
Yeah.
Take that distance. Okay, that's the distance, right? Correct. Yeah. Yeah.
And then,
Can I put my hands like that instead of straight?
No, like that. Yeah, like that.
Yeah.
Now, go up the wall. And we'll help you, we'll help you. Now. No, you have to go flat to the wall. Flat to the wall. Don't worry. You'll not fall, I'm here. Yeah, there. Push. Stay. There. Yeah. You need a lot of support.
I did. And I was good with my legs.
no, I'm still working on it.
Use my mat. You need a yoga socks, otherwise you'll see. Yeah. Okay, as long as it has good. No.
She did it, but yeah, that is something.
No, my feet are too high.
Yeah.
So,
You got more inverted.
That's where they are.
I know.
That's where they are. So now go up the wall.
Okay, that's good.
Start walking down. Walking down. Push now. Now you are correct. Like push. There we go. Yeah, this is good. You have a great core. She's awesome.
Yeah.
Yeah, that's awesome there.
Yeah, just walk. And stretch your knees.
Okay. Same effect.